Hello, my name is Krishna. My student ID is 33907-226. I'll be presenting my pathogen video presentation on Mycobacterium ulcerans, titled The Mosquito Bite That Doesn't Look Quite Right. Here is the overview of my presentation. I will start with an introduction into Mycobacterium ulcerans, then epidemiology, and then the transmission of Mycobacterium ulcerans. Then I'll talk about Mycobacterium ulcerans virulence factors and their role in pathogenesis. Finally, I'll talk about the diagnosis, treatment, then prevention of Mycobacterium ulcerans. I will end with an acknowledgements and reference slide. Number 1. Let's start off with an introduction into Mycobacterium ulcerans. Firstly, it is the causative agent of borrelic ulcer. Secondly, it is a neglected tropical disease listed on the World Health Organization. Mycobacterium ulcerans is part of the Mycobacterium family. It is the third most common Mycobacterium infection. Mycobacterium ulcerans produces a lipid toxin called the mycolactone toxin. This toxin is an important virulence factor. Mycobacterium ulcerans has a unique cell envelope structure. Firstly, it is made of a peptidoglycan layer, then an arabinogalactan layer. This is followed by mycolic acid, which is a fatty acid chain which makes a thick, waxy, hydrophobic barrier preventing stains from penetrating through. Arabinogalactan acts as a bridge connecting the peptidoglycan inner layer with the outer mycolic acid layer. Due to this unique cell envelope structure, Mycobacterium ulcerans requires a unique staining method which we will discuss later on. Furthermore, it is a not gram-positive or gram-negative. Now let's move on to the epidemiology of Mycobacterium ulcerans. Number 2. Mycobacterium ulcerans epidemiology. Mycobacterium ulcerans has found to have increased prevalence in the Mornington Peninsula, found in the southeastern suburbs of Victoria, Melbourne, Australia. Mycobacterium ulcerans is also highly prevalent in Africa. It causes a non-communicable disease, meaning it is not passed from person to person. In monitoring public health, we found Mycobacterium ulcerans has highest prevalence in Africa. In Africa, it has the highest morbidity rate of 159 per 100,000 people and a mortality rate of less than 1%. The cause of outbreak has been identified as contact with contaminated mosquitoes and contact with stagnant waters. Institute recommended control measures are to wear protective clothing. Also, occupational exposure for farmer and fishermen. Recommended control measures are community education, active surveillance, community-based surveillance to report new cases, and more treatment centers. The epidemiology for the determinants of infectious disease for Mycobacterium ulcerans pathogen include the virulence factor of the mycolactin toxin, the tropical and subtropical environment this pathogen is found in, and host susceptibility, such as immunocompromised people with AIDS. Now let's move on to the transmission of Mycobacterium ulcerans. Number 3. Transmission. New research by Tim Steiner and his team have revealed Mycobacterium ulcerans is transmitted through mosquitoes. This solves the mystery of Mycobacterium ulcerans transmission, which was previously unknown for a long time. Possums have been revealed as the local wildlife reservoir for Mycobacterium ulcerans here in Australia. PCR screening has revealed a positive association with Mycobacterium ulcerans, positive cases, Aedes nodoscriptus mosquitoes, positive cases, and statistics by Tim Steiner and his team have revealed overlap between positive clusters of Mycobacterium ulcerans, Aedes nodoscriptus mosquitoes, possum extrateria, as well as borrelic ulcer positive cases. Mosquitoes spread the disease by feeding on and inoculating humans. A common transmissions route in Australia is mosquitoes feeding on possums and possums infecting humans. Furthermore, bacterial genome analysis has confirmed a single shared nucleotide between Mycobacterium ulcerans, mosquitoes, possums, and humans. Now let's move on to talk about Mycobacterium ulcerans virulence factors and these virulence factors' role in pathogenesis. Mycobacterium ulcerans causes disease primarily through tissue damage called the borrelic ulcer. This is done through the virulence factor of Mycobacterium ulcerans toxin production. In particular, Mycobacterium ulcerans mycolactone toxin. This mycolactone toxin is a lipid toxin, which allows it to interact with our host cell membranes as they are also made of lipids. This lipid toxin causes damage to our host cell integrity and function. The mycolactone toxin suppresses immune cells, particularly targeting immune cells such as macrophages, and interferes with the production of pro-inflammatory cytokines such as TNF-alpha and interleukin-6. This suppression by the mycolactone toxin prevents a full host immune response. This causes immune suppression. The mycolactone toxin also causes apoptosis. This is the cause of necrosis, also known as tissue death, which is seen in the borrelic ulcer. Mycobacterium ulcerin has a particular lipoprotein that extends from the peptidoglycan layer in its cell envelope all the way out to the mycolic acid. This is recognized as self by our host immune system, hijacking our PAMPs and PRR function, allowing immune evasion and establishing infection. This lipoarabinomannan is a very important virulence factor in establishing pathogenesis factors. Now let's move on to talk about the diagnosis, treatment, and prevention of Mycobacterium ulcerans. Mycobacterium ulcerans is diagnosed through clinical assessment, as stated. It is also diagnosed by microscopy as well as a few other ways, but clinical diagnosis and microscopy have been the two main ones in my research into Mycobacterium ulcerans. In particular, we can diagnose Mycobacterium ulcerans in clinical assessment as a mosquito bite that doesn't look quite right. Clinical assessment also includes painless ulcers, skin swelling, lesions on the limbs, also known as areas of the skin that look different from the skin around it. Furthermore, microscopy is done through skin samples of the borrelic ulcer on patients added to a slide. The smear is added to the slide and goes through a special staining technique for acid-fast bacteria known as Zell-Nelson staining. We use this staining technique as we are looking for acid-fast bacteria, which Mycobacterium ulcerans is. We look for this proof. So how does this staining method work? First, the borrelic ulcer substance is taken from a patient and transferred onto a slide. It is air-dried. The slide is then heat-fixed. The primary stain carbofusion is added, which is the red dye. Then acid alcohol is added for decolorization. Finally, methyl blue is added as the counterstain. The slide is then finally rinsed and ready for microscopy examination. If Mycobacterium ulcerans, the acid-fast bacteria, is present, the slide will stain red and be seen as red under microscopy examination when looking at the microorganism under a microscope. How do we treat Mycobacterium ulcerans infection? We can treat Mycobacterium ulcerans infection by using effective antibiotics, such as rifamycin and streptomycin for 8 weeks. If patients have issues such as an allergic reaction to streptomycin, clarithromycin is used instead with rifamycin for 8 weeks. We can also do surgical removal to remove damaged tissues. Proper wound management is also necessary, such as changing bandages regularly, and also prevent contamination with the external environment, which is full of pathogens. Pain management is a serious issue with this disease, so analgesics may be used to reduce pain and help with pain management. Regular follow-ups to monitor the effectiveness of treatment and to manage any complications with the treatment, such as antibiotic use complications, to make sure the patient is treated okay and in good health, is also required and necessary in this condition. To prevent Mycobacterium ulcerans, there's a number of things we can do. Mycobacterium ulcerans can be prevented by stopping mosquitoes from biting us. Reduce mosquitoes spreading in and around your home. Also use insect repellents. Wear protective clothing that prevents mosquitoes from infecting us in the first place. And lastly, eliminate stagnant waters, which is a breeding ground for Mycobacterium ulcerans. Acknowledgements and references. The continuation of my reference list. This is where I have sourced and cultivated all my information from. Please feel free to look at this primary peer-reviewed journal articles for more further information.